Hey everyone, I think we've got the meeting going live on YouTube now. So I just want to welcome everybody for joining us this afternoon. We are recording the session so that you can go back and watch it later or share it with someone who maybe wasn't able to participate. And I'm very excited to have a wonderful panel with us from Novant Health Cancer Institute. And to moderate this panel, we have Felicia Dobson, who many of you know is a patient advocate with Cancer Services, and she's been with us for many years. And I'm glad to have her with us today to help with this session. And so if you have any questions during the webinar, you can put them in the chat box or in the Q&A, and we'll help Felicia field any of those questions. So Felicia, I'm going to turn it over to you and let you introduce our panel, and we'll get started. Thank you.
So hello, everyone. I'm so glad you've joined us today. Again, I'm Felicia with Cancer Services. I've been a patient advocate here this is my 12th year. So really glad to be with such a wonderful organization. So today we're going to talk about what happens once treatment is over. So many cancer survivors feel that although they are happy that treatment is over, they also wonder about what comes next. And many say that they had lots of information and support during their illness, but now there are new questions and concerns to address. So that brings us here today as we celebrate Survivors Week and to speak about what comes next after treatment. We have a wonderful panel of specialists today, Dr. Josiah An. He's a medical oncologist with Novant Health Cancer Institute. We also have Sara Bridges. She's a licensed clinical social worker with Novant Health Cancer Institute. And Andrea Simmons, who's a chaplain there with Novant Health Cancer Institute. So if you three wouldn't mind, please introduce yourselves briefly, and then we'll start with Dr. An.
Hello, my name is Josiah An. I'm one of the medical oncologists here at Novant Cancer Institute, and I focus on GI oncology and sarcoma.
I'll go next. I'm Sara Bridges. Like she said, I'm a licensed clinical social worker, and I do counseling with patients and sometimes family members in the outpatient cancer center anywhere in the Winston market. I've been working in healthcare and emotional health in regards to how we deal with our physical self throughout my career. So I'm glad to be here. Glad to be here with y'all today.
Hey, I'm Andrea Simmons. I'm a chaplain here at Novant Health Cancer Institute. I'm both inpatient and outpatient, and I provide care, spiritual, emotional care to staff, patients, family members, loved ones, whatever. And I'm really glad to be here today.
Thank you so much. Thanks, Dr. An.
All right, can everyone see my screen? So once again, I am one of the medical oncologists, and I am very happy to be here. Today we'll discuss cancer survivorship. So this brings us to the definition of being a survivor. So who's a cancer survivor? Cancer survivor is anyone with a diagnosis of cancer, regardless of treatment, regardless of being in quote unquote remission, which we'll discuss the definition of remission, or someone who's gone through treatment, you're 10 years down the road, 5 years down the road, and you're just seeing your primary care physician. So basically survivorship starts at the time of diagnosis and includes at the time of initial treatment. Let's say you've been recently diagnosed with cancer and we're waiting to start treatment. You are a cancer survivor. Let's say you have been under surveillance. You are no longer having any cancer on imaging, but you're still going through CT scans every 3 to 6 months or yearly, and you are a cancer survivor. What about if you had recurrence of disease? You are also a cancer survivor. Let's say you have cancer and you've gone through treatment and you've said, oh, I want to focus on my quality. I want to spend more time with the family, and you're still a cancer survivor. So what are some of the common terminology for our cancer survivors. If you're under active surveillance, that means you are being closely watched. You've gone through treatment, you are in whether you had response and whether the cancer is about the same and it's not growing. We don't see any cancer on imaging and on endoscopy or other areas of modality. And we're just going through imaging and just follow up with the physical exam, then that would mean active surveillance. What about remission? So that means you have gone through treatment and we don't see any evidence of cancer. So you're not in the stage of cure yet, because we typically discuss about the cure after a finite period of time. Mostly it is about 5 years, but certain cancers we know it can come back after 5 years, especially those that are not as aggressive, they can come back later. So we say you're in remission, you're not in the state of cure yet, but then we are getting to that point at a certain point of time, as long as the scans and physical exam and, for example, colon cancers, we do colonoscopy first year after the surgery, and then we continue with colonoscopy every 35 years after that. So if you, for colorectal cancer, I see a lot of patients, colorectal cancers, pancreatic cancer, we say it's been 5 years, technically you're cured at this point, but we still want to make sure that you're doing okay. And we're going to talk about some of the aspects of what we do after the treatment. And we'll also discuss about some of the aspects, important aspects in life during treatment. So when we talk about cancer, we typically talk about the cancer statistics. This is estimated new cases for 2022, and this is from American Cancer Society. If you go to the research area, you'll be able to see these two boxes, and you can kind of see yourself where you're at. So for breast cancer, there are about 290,000 people to be diagnosed, estimated to be diagnosed with breast cancer. In prostate cancer, we see that about 270,000 people. And then lung cancer, 230, colorectal cancer, 151, and so on. What about anyone developing cancer? So we can see that we know that based on the recent research, about 1/3 of the US population will develop cancer during their lifetime. And I think recent studies are saying almost 39%, 40%. So for breast cancer, among females, we know that 12.9% of the people in the US during their lifetime will develop breast cancer. Prostate cancer, about 12.5% for those who have prostate, so men. Lung cancer, about 6.1%, more in those population who have smoked or who are smoking. And then colorectal cancer, 4.1%, melanoma, 3%, and so on. What about some of the characteristics as we move on? So you can see that, and I'm going to try to change the pointer to the pen. So these are the cancer survivors. You can see that the number of cancer survivors, so anyone with a diagnosed cancer, has been increasing since 1975. You can see that it almost tripled compared to 1975 at current day 2020. So almost 4 times actually. And then the population within the different age groups, you see that during this time about equal between age 50, 60, 70, and 80. But then you can kind of see that at 2010, that we do see significantly more younger people. So 50 to 64, and we're also seeing 65 to 74 significantly greater. Some 75 to 84, and then of course, with the growing number of incidents with better technology, earlier screening, for example, colorectal screening. Since 2 years ago, we were recommended to start screening with colonoscopy at the age of 45 instead of 50. And then we are estimating more and more younger people to be diagnosed with cancer. So this brings a good point of making sure that we go through screening. If you have any abnormal symptoms, big lymph nodes, let's meet with the primary doctor and see if it's something that we need to biopsy or is it something we can monitor, and so on. So during cancer treatment, there is there are a lot of factors that come into play. So knowing how you're going to tolerate the treatment, knowing what you can do, how much activity can you have, what are you going to be eating. So self-awareness is a very important aspect to be recognizing how you are at current state and how much you can do, and what are some of the things that you can do to deal with this diagnosis. It is a very difficult diagnosis. It is life-changing. At the same time, you do have a lot of, so every aspect of everything that we're talking about, we do have help. So in the clinic, in the hospital, we have our counselors, our dietitians, we have our physical therapists, and then we have our social workers to help out. And we have, cancer services that we can help you with appearance. Are you going to lose hair during the chemotherapy? What about weight loss? What about, none of the clothes are fitting me at this time? Is it going to affect my, how am I going to cope with it? And is it going to affect my family and friends, as you can see? So all of this is very important, and you do need a lot of help during treatment, and whether that's being close to your family and getting help from the family or friends or neighbors even. So what are some of the latest research that we find in terms of survivorship? There was from Journal of National Cancer Institute, Dr. Sung had presented that if you're diagnosed with cancer during the time of adolescence and young adults between age 15 and 39, you are more likely to have secondary, the risk of the mortality is greater. And this can be from secondary cancers. This can be from, the fact that your immune system is weaker. This can be from infection. So this kind of highlights the fact that it is important to continue to look for any other signs and symptoms that you may be developing in the future, that you can bring it to attention by the primary doctor or your oncologist. Yabrov and his colleagues, or her colleagues, presented a paper at Journal of National Cancer Institute just recently in April. The medical financial hardship, whether that's insurance problem, whether that's job issues, it does increase the risk for mortality for our cancer survivors. And then Dr. Hellegren presented at Journal of Cancer Survivorship this year that cancer treatments can create difficulties with employment, especially for rural women. And it's a very interesting article that, finding a job at the same time, keeping a job is very difficult. For example, a lot of my patients, they do get chemotherapy and they're hooked up to a chemotherapy pump for 46 hours, sometimes 96 hours. And it is difficult when you're hooked up to chemotherapy or pumps to, go and carry things or be at the, work, exert yourself or do certain things. And it is often very, very difficult. Dr. Gupta presented that, and this was an interesting subject because COVID-19 has been so, it's been affecting the society and a lot of our patients, that if you are a adolescent and young adults or during the age of childhood, the risk of COVID infection and its complication has not changed. So you don't, compared to general population, you're not more likely to have complication, or you're not more likely to die from COVID-19, which is reassuring. And we do recommend, COVID vaccinations for that reason too, to prevent, for especially elderly population, that you're at higher risk for complications. So this is focusing on the younger patients. What about the ethnicity? Does that play a role? And we do know that during the San Antonio Breast Cancer Symposium from last year, Dr. Barrio presented that African-American women with breast cancer have higher rates of lymph node being lymphedema, meaning the swelling of the arms after lymph node dissection. So surgery to remove the lymph node for the breast cancer, compared to the Hispanic population, Caucasian and Asian women. And then when we compare Hispanic women to the Caucasian population and Asian population, we know that there is greater risk for lymphedema, meaning the swelling of the arm, compared to Caucasians and Asians. And then Dr. Kwan had presented in February at Journal of Clinical Oncology that breast cancer survivors are at higher risk for developing high blood pressure or diabetes. So it's very important to continue to follow up with your primary doctor and, yearly test, or, every 6 months if you're going through labs, then, sugar level is something that might kind of point towards, are you developing prediabetes? Are you developing diabetes? What is my blood pressure? And your doctor might say, let's check your blood pressure every day and just make sure that it's doing okay. And then you can start on medications or exercise, or start with the diet changes. Dr. Cowell presented January this year at Journal of American Medical Association that prolonged sitting, and that's what mean more than 8 hours a day, or lack of physical activity, meaning less than 150 minutes per week. So typically that would mean 30 minutes a day for 5 days. If you're not doing that, then your risk of death is actually higher, which is associated with a lot of things that we'll sort of talk about, because we know that physical activity is important for your cardiovascular health, but also in a lot of different areas, including diabetes, including risk of stroke, and so on. And then sitting time, being stationary, has not been shown to be beneficial for our patients. What about the chemotherapy side effects? And these can be short-term or long-term. So fatigue is one of the most important and one of the most prevalent side effects for chemotherapy, whether that's immunotherapy, surgery, or radiation therapy. Pain, certainly, it's one of those that we want to control because it can really affect your emotion and also physical ability to eat and walk around, gain strength, and so on. Weakened immune system, and then also swelling of arms or legs. Some of the medications cause your arms to be swollen. Some of the medications can cause legs to be swollen. What do we do about it? Do we start on, water pill? Do we get you some stockings to really compress the swelling? And then what about memory problem? We have patients who go through chemotherapy and for a long time they have memory problem, or even with the first dose of chemotherapy, you feel like you're in a cloud, and that can certainly happen. For especially some of our younger patients and even elderly population, infertility is a big subject. We discuss about fertility preservation, meeting with our gynecologist team. Is there anything that we can do? And then sexual function, especially with radiation to the pelvis, and for males and females who have gynecologic cancer or ovarian cancer, prostate cancer, and so on, this can be compromised. And we know that even just regular chemotherapy or immunotherapy can sometimes drive the sexual function lower. What about numbness, tingling, and balance issues with chemotherapy? This is fairly common. Sometimes it does not go away. Sometimes it goes away after a year or two, sometimes a few days. So these are some of the common side effects that we always keep in mind when we see our patients. What about the other components of survivorship? So these are sort of a big umbrella for survivorship. When we are a cancer survivor, we talk about we are trying to make sure that we don't have recurrence. If there is a recurrence, then we try to find early, is it something that we can remove so you can go back to what you were doing before? You can enjoy time with the family and friends. Are there new cancers? Do we need to start treatment with chemotherapy? Do we need to get radiation oncology on board, and so on? Surveillance, so how often do we do the scans? How often do we do endoscopies? What about mammogram, and so on? And then you can also develop secondary cancers with chemotherapy or radiation therapy. You can develop sarcoma or lymphoma or leukemia sometimes. And then what about the long-term effects? We sort of talked about the chemotherapy side effects that can last long. It can be 3 months, it can be 6 months, it can be lifelong. And what are some of the things that we can do to help, whether that's meeting with the specialist, a doctor, or meeting with physical therapist, meeting with our oncology dietitian, or even pharmacist to talk about some of the side effects of the treatments that we give for the long-term side effects of cancer and its treatment. And then, of course, the being a survivor would mean that you are being seen by multiple specialists. And this could mean physical therapist, dietitian. It could mean our oncologist and our advanced practice providers, as well as primary care provider. So healthy lifestyle comes up a lot when we meet with our survivors, whether you're going through treatment or not. We discuss about decreasing alcohol intake. We know that the alcohol can affect the liver, but it can also affect the mood. It can affect the sleep. So we want you to be doing well in terms of the performance, meaning if you wake up in the morning, are you still tired? Are you able to get out of bed? Are you able to, if you're still going to work, or can you go to work? Can you go for treatment? It's one of the measures that we have in terms of proceeding with treatment or going for imaging. Weight management. Are you losing weight? Are you gaining weight? Those are some of the important measures that we look at. And also it does really play a key role in terms of your happiness and interaction with your family. Physical activity. Are you able to get up and take a shower every morning? Are you able to go out for a walk with your friends, with your neighbors every day? Healthy diet is very important. This kind of plays a role with weight management and healthy diet. So it doesn't necessarily mean that you are losing weight. It just means that you're not losing weight, you're keeping up with your muscle content in your body. Muscle is a very important aspect of cancer because if you're not able to get up and walk, if you're not able to reach to certain places, you become more tired and deconditioned and becomes a vicious cycle. Smoking cessation is very important because we know that studies show that treatment do not work as well if you're smoking because smoking causes a lot of inflammation. And one of the ways that we kill the cancer cells with treatment, whether that's surgery, radiation therapy, chemotherapy, or immunotherapy, target therapy, is that we cause inflammation by killing the cells. But then if there is already an inflammation going on, sometimes it is difficult to kill the cancer cells. So I wanted to touch base on other cancer survivors. This is a very key factor for being a survivor because what this means is basically your family, friends, or your neighbors, or anyone that comes to clinic with you or who's able to help you in any way, whether that's physical or emotional. We know that caregivers have very similar side effects from the treatment or from coming to clinic because the family members or friends, they're also tired by coming to clinic. They're talking to you, trying to address a problem of pain and then difficulty with the diagnosis of cancer. At the same time, they can feel, they can start having weakness, have decreased appetite, weight loss. A lot of cases, we do see the provider's family with depression, anxiety, and also PTSD that can last a long lifetime. And then financial troubles because sometimes the caregivers are not able to work certain days. They are not able to keep up with the job and so on. So what are some of the resources that we have at Novant Health? Of course, you have your oncologist, your surgeon, radiation doctor, and gynecologic oncologist, but we do have the advanced practice providers who are always reaching out to our patients. We do have primary care physicians and also your cardiologist, your lung doctor who are in that area. If you have lung cancer, they might want to see you. You might want to give them a call if you are feeling short of breath. Is there anything else going on? So you have a lot of resources that you can reach out to. What about integrative clinic? This is a very sort of comprehensive clinic that focuses really on the patient as whole. So they provide acupuncture, massage therapy, yoga therapy, meditation. They can talk about some of the very well-researched vitamins and herbals. What about stress management? So it's a very good resource for our patients that they get to experience different therapies to really focus on yourself. We have our dedicated oncology pharmacist for each subspecialty. So we have our GI cancers, we have a dedicated pharmacist for gastrointestinal cancers. What about oncology social worker? And Sara will sort of discuss her role, and then our chaplain will discuss more about that aspect too. Oncology dietitian, and this is part of the survivorship. They can discuss about the weight and what are some of the ways that you can change your diet to make it a more healthier, but at the same time, you derive joy from eating. We have our oncology nurse navigators, and these are nurse navigators specific to each area of cancer. So there's breast nurse navigator, breast cancer, colorectal cancer, we have lung cancer nurse navigators, and they check in on you during treatment and even after treatment. What about symptom management clinic, or sometimes we call this clinic a palliative care clinic? If you're having a lot of nausea during the treatment or even after treatment, after surgery, they can help you with nausea medications, focus on fatigue. They can give you a medication or refer you out to, in addition to seeing your doctor. And physical therapy, occupational therapy, speech therapy. So after treatment or before treatment, if you're having difficulty with weakness, or if you're having balance issues, we can always get you to see someone to help with your strength and provide you with the right equipment. We also can do examination for your home to see, is there anything that we need to, if you have stairs, is there anything we can get you to improve that in terms of getting up the stairs, or even do we need to get a new place so that you can have a safer environment that you don't fall. So what are some of the other things that we can do to sort of feel that you're part of Novant or part of this survivorship? We do have a booklet. It's called The Unexpected Gift. And this is made up of 21 first-person essays of cancer survivors. And we also have support groups that we have, and those you can discuss further with our nurse navigators who lead the support groups. And this book can be given for free as long as you reach out to our cancer services. You can stop by the desk, reach out to one of us, and we can provide you with the booklet. And everything that we discussed during my discussion, you can find it on American Cancer Society, American Society of Clinical Oncology, and some of the other websites. And I'm happy to share any of this information. At this time, I'll hand over to Andrea and Sara and go from there.
All right. Felicia, do we want to do questions for Dr. An and then us go, or you want us to go and then we do questions all at the end? It doesn't matter to us.
If you could please go, and then we'll do questions at the end.
We can do that.
Thank you.
All right. Let me see if I can share. And then Andrea is going to get us started. All right. You are up, Andrea.
All right, thanks, Sara. You can go ahead and go to the next slide. So I thought we could start with a centering moment, which is something that I do with any group that I lead, or even with Schwartz rounds, which is something we do here at the hospital that has panelists as well. It just helps you to get into the space. And it's a great way to just bring you back in after sitting and listening to a lot of information and help regulate your system. So what we're going to do is a progressive muscle relaxation centering moment. So what we're going to do is we're going to tense certain muscle groups and then relax them. And what it does is it gets you used to feeling that tension in your body so that you can start to relax them naturally without having to do the tension. Because if you're like me and you've been clenching your jaw for the last 20 years, it's kind of nice to get back in your body, since in the West, we tend to live the neck up, and worry and everything. So get settled in your seat, or if you need to stand, you can do so. You can either close your eyes or keep them open. And you're going to start with your hands. You're going to clench your fists And if anything is uncomfortable, please just ease into it how you need to. And just notice that tension in your hands. What does that feel like? We're just going to hold it for a moment. And then you're going to slowly unfurl your hands. Are they tingly? Do you feel the relief from releasing the tension? And then we're going to flex the muscles that's back here on the back of the meaty part of your arm. Just going to pull your arms back. Let them tense. Feel your shoulder blades kind of come together. And then relax out of that. And notice whatever feelings are coming up. And next, we're going to roll into your biceps. So like your Hercules, like twist those muscles up and tense them. And then relax. Let's take a deep breath there. In through your nose, out through your mouth. We're going to come up to our head and focus on our face. And I want you to scrunch your brow together like you're trying to figure something out. And then you're going to relax and squint your eyes. And relax. And we're going to come into our jaw. So you're just going to open your mouth and kind of let it be tense. And then relax out of that and notice the softness that comes back into your jaw. And finally, we're just going to take our head and lean it back and stretch your neck and tense those muscles in the back of your neck. And then we're going to come back to center. And when you're ready, you can open your eyes and rejoin the session. Sarah, you can go ahead and take it away from there. Oh, no, this is me again. Sorry. So one of the things that I wanted to talk about with survivorship is trauma in relation to cancer, because a cancer diagnosis is a really traumatic thing. It kind of shatters your world and it removes that feeling of safety. And I was talking with a patient today actually about how you never think it's going to happen to you, and then it does. And what do you do with that? So this is a quote from The Big Ordeal by Cynthia Hayes, and it says, just as traumatic experiences in a war zone can lead to PTSD for a soldier, so too can the diagnosis of cancer for any of us. And while sudden loud noises are a common trigger for war-induced trauma, a medical test or scan is all that is needed to remind us of the existential crisis initiated by a diagnosis of cancer. Next slide. So, one of my favorite theologians who wrote Spirit and Trauma, Theology of Remaining is Shelley Rambo. You can go back, sorry. And she talks about interviewing a pastor who lived through Katrina. And he said that there's no before the storm anymore. We're living in after the storm. And cancer is like that too. There's never going to be a moment in your life moving forward where you haven't had cancer. Like you can't just go back to before the diagnosis. And sometimes people get stuck because they're trying to get back to their life. And they're like, gosh, why can't I feel normal again? Why can't I not worry about this anymore? And they beat themselves up. But when you realize that you're not the one that's in control over that, and that you just need to be in the moment, it kind of makes it a little more easy on yourself and your spirit. So this is kintsugi, which is a Japanese art form where if pottery breaks, they put it back together kind of with like this gold overlay that you see here. And that's kind of the way I like to think about our spirits, is they break whenever we have a traumatic experience. But when you put it back together, you can tell that it's been broken before, but now it has these overlays. So what are the overlays in your life that are helping you be put back together? What are some of the things that you're grateful for? Is it your family or your friends? Is it the resilience that you've developed after going through this experience? Is it your church? Is it your connection with the divine? However you do that. So whenever you're thinking about trying to get back to before, maybe instead of that, you can think about, how do I move on from now? You can go on to the next slide.
All right, perfect segue. So I am someone who loves quotes, and I'll read this quote to you. It's kind of just touching on what Andrea was just sharing. Life changes. You get it all lined up just the way you like it, and then something beyond your control comes along and bumps you off center. Nothing stays the same. You grow up, make friends, lose track of people, meet new ones, and sometimes you ask yourself why. But all I can tell you is that every single experience you ever go through changed you in some way. Every new person that comes into your life changes you. Every moral dilemma or emotional experience you come up against changes you. It's your job to decide how. So again, as she was saying, there is no way, to go through this and not be changed. And kind of acknowledging that, accepting that, I think is a good place to then kind of begin that process of moving forward. Let's see, sorry. So I just kind of wanted to touch on some common experiences that patients who are in the process of kind of going from treatment into survivorship often express, because I think validating how that experience is for people can be empowering. And so sometimes people kind of talk about this as the in-between. Not yet well, but not necessarily still sick, right? If we use those words. We've been kind of often cut loose by the significant medical monitoring. And so patients are often told, we just kind of are let go and don't have an appointment for 3 months, even though we've been here twice a week, every week for months. And at the same time, there's but watch closely, be careful, make sure you're on top of things. So it's a dance of, go live and be cautious. And so that's an in-between. Oftentimes people around you may expect you to jump back into the way life was before. None of us know what this process is like until you're in it, until you go through it. And so because of that, others don't recognize that you're not just the same person. You are a person who's been changed. And so you're in between trying to figure out what that process is. Oftentimes people express being pleased to be at this point, that this is a big milestone and that others are celebrating around you, but that you may not quite feel the same celebratory feelings. People often talk about a whiplash, that there's kind of everybody saying, yeah, you're done, it's great. But patients say they don't necessarily always feel that. They often feel like, wait a second, what just happened? What have I just lived through? The what now question. And so being able to be present with those people celebrating too, and also being at a place of trying to process is kind of where people often are. And also just kind of a conundrum of feelings. So sometimes people will say, I'm so glad to be at this point. I'm so glad to be done with treatment, but I'm down, I'm depressed. Maybe I even feel guilty for feeling that way, right? Because I'm one of the lucky ones, or my cancer wasn't so bad. I often hear that it could have been so much worse. Why am I not just grateful? And so these kind of conflicting feelings of being grateful and thankful to be at that point, but also struggling. So an in-between. So one of the things I often talk to people about is the both and, that we can be strong and vulnerable. We can be independent and connected. We can be grateful to be at this point and still sad that we had to experience this process. We can be confident and scared. We can be all kinds of things that oftentimes I think we feel like are contradictory, but we're complex beings. And so it is always okay to recognize the variety of things that we're feeling, and that actually that's very healthy, because we're very rarely are we just one thing. One of the things that Andrea touched on is that I never thought it would be me type of thing. And I wanted to speak to this because this is another theme that is really prevalent with patients. Two pieces that I kind of want to touch on. One is, I love definitions. So control. One definition of control is to exercise restraint or direction over. And then another word I want to talk about is precarious, dependent on chance or circumstance, unknown conditions, or uncertain developments. Often, many of us walk around with this illusion of control, this idea that if I do all the right things, whatever those are, that everything in my life will be okay, that I won't get cancer, that I will always have a job, that my marriage will be great if I just do these things. And the problem with that is that we can do all the right things and life still go in a different direction, as you all have lived since you've had cancer, right? None of you, more than likely, and unless there's very specific circumstances, are people going along and anticipating something like this. And so we're often in this place of this illusion of control, right? I've got my life, I've got it figured out, everything's going as planned. And I kind of see it as I'm going 70 miles an hour and I'm T-boned by the reality of the precariousness of life. That you weren't doing anything wrong, and yet something still happened. I've had patients come in and say, look, I eat vegan and I do marathons and I have done all of these things. This was not supposed to happen to me. And that can be pretty groundbreaking, because I think what it does is it doesn't just say, hey, we can get cancer. It says, hey, all kinds of bad things can happen. Hey, we are vulnerable just by being human. We're vulnerable. And that can be scary, especially when we're holding on to this illusion of control, right? So I just encourage you to recognize that if you're feeling down or scared or overwhelmed, or anxiety is a thing you've never had to deal with, but you are now, there's a lot of reasons why. And it's not just because of the cancer and the treatment, right? It's because sometimes it rocks our whole foundation of the way we see things. The other thing I want to always kind of express is impact versus control. We may not have that control that we kind of think of, this illusion, but we do have impact. So for my patients that say, I exercised and ate healthy and I still ended up with cancer, I say, yes, you didn't control cancer, but you have impacted your health tremendously, because you've exercised and you've eaten healthy and you've showed up to your appointments. So we don't have control, but we do have tremendous impact on our health. And those are some of the things Dr. An was talking about earlier, the ways that we can try and be healthy moving forward. And I'm going to talk more about those, both physical, but also really emotional ways we can try and be healthy, because those things do impact our life, not just how we deal with cancer, but how we deal with the other things that happen because we're vulnerable humans. So some of you, or maybe everybody's familiar with this. This is kind of the cognitive behavioral theory. And it's very well known, but it's also very powerful if you can wrap your head around it and kind of embrace it as a way of thinking. So the idea behind it is that we have a thought that creates a feeling that then impacts behavior. Now, you know, when Andrea said we kind of live above our heads, I think, you know, our society spends a lot of time in thoughts, but I would also say that we also really, really attach to feelings. And what we do is we attach to feelings and we don't separate the feeling and the thought out, right? So we, and then we over-identify with this feeling, which can become very overwhelming. So the tool or the thing that I would encourage is for you to start to recognize when you have a feeling and then identify the thought of it, because that's where the power of having healthier thinking can come into play. So for example, if before this today, I was feeling anxious, I could kind of sit in that anxiety and worry and think, oh my gosh, you know, I'm not ready. I'm really anxious. I'm really sweaty. Who knows how this is going to be. Or I could recognize I'm feeling a little anxious and I could think, okay, what's this about? Well, I, you know, want to do well today. And I, you know, what are the things that I know I've prepared. I know I have experience in this. I know I'll do the best I can. And so those thoughts help me to feel less anxious, right? So that's where the power comes, is in recognizing feeling and then helping to redirect thoughts that then have, you know, healthier feelings. And both of those things create or impact behavior. So just something to be aware of, because I think that we often are aware of how we feel, but we don't separate out that thought that is actually impacting and causing that feeling. And oftentimes people say, well, we can't help how we feel, which is true. We can't help how we feel about something, but we can shift the way we think about it. And that's what changes the feeling. So anytime we're feeling anxious about something, recognizing it and then going to what are my thoughts about it? Okay, I have a scan coming up and I'm feeling anxious about it. Okay, well, what are my thoughts? Well, I know that scans happen every day and everything's okay. I know that I've had, you know, one bad scan, but then I've had 3 good scans. And so very much maybe today is going to be another good scan. I have no other reason to think that something's wrong. My body hasn't, you know, I'm feeling okay. Anything that can help you to reduce this anxiety as you're going into that scan. So really just being aware of feelings and then how they're related to our thoughts. And then one of the things that kind of goes along with that is this idea of fast thinking or slow thinking. I like to refer to it as autopilot. So the fast thinking is more autopilot and the slow thinking is more intentional thinking. And oftentimes we run on autopilot, right? We think we're anxious about it, anxious about whatever, and we stick with that and we hold on to that and we let our thinking be driven without saying, well, wait a second, how am I thinking about this? And what's a healthier way of thinking about this? And is that really rational or is that completely based on emotion? You know, so there's lots of information out there about this concept around autopilot versus more intentional thinking. And that can be a very empowering step as well, is realizing that you do have some control over the way that you think about things. And so taking some power in that can be helpful. Again, intentionality, so slow thoughts. Think in ways that are healthy. Oftentimes patients will say, I just need to be more positive, or my husband keeps telling me to be more positive. I'm not a big fan of the think positive, and I'll tell you why. It's because if we say think positive, then we are devalidating the concerns that person has. Now, I'm not somebody who says, you know, let's hold on to the concerns we have, but I think instead of think positive, I try to say, let's think healthy. What are healthy ways to think through this? Okay, I'm concerned about a recurrence because I know there's always the chance of that and life is precarious. And I'm really hopeful that I'm going to continue to do all the things I can do and take good care of myself. And I'm going to lean into that. So it's this intentionality around both, around accepting the things we're concerned about and giving them the validity they need, while also really leaning into the hope and the positivity and those kinds of things. Your mind will always believe everything you tell it. Feed it hope, feed it truth, feed it with love. So if I keep telling myself something that isn't helpful, my mind is hearing that. It's holding on to that. That's where that intentionality really comes into play. I don't know how many of you are familiar with the feelings wheel or feelings circle, but it's a neat tool. I have it in my office, but it really kind of breaks it down into some of the very the more familiar emotions or feelings, and then it kind of goes off into more minute, kind of very distinguished, specific feelings. But it can be very healthy in identifying really how you're feeling specifically about something. And one of the things that I like to, there's a neat podcast that I enjoy, and there's a researcher that talks about feelings are data, right? Think about that. If after today, Andrea calls me and says, Harry, you didn't do very good today, and then I felt really down and sad, what does that tell you? What is the data about that? Well, the data is that I want to do a good job, that I care what Andrea thinks, that I don't want to disappoint colleagues and cancer survivors. That's the data. Anytime we have a feeling, it tells us something. If she said that to me and I was like, I don't care what you think, well, that tells us something, So recognizing how you're feeling and then kind of peeling it away. What is that about? What does that mean? Be curious about it. Those can be very healthy ways of recognizing how we feel about whatever our thoughts are. But it does give us information. Another thing the same researcher talks about is the importance of giving yourself space from your feelings. So if I'm angry, one thing that's much healthier for me to say is I am feeling angry versus I am angry. Now, I know that sounds so silly and simple, but the difference is that I am not over identifying with it. I'm not saying I'm an angry being. I'm saying at this moment in time, I feel angry. Feelings come and they go. So right now, what am I feeling? I'm feeling angry, but it doesn't mean I am angry. And when I said, this quote about your mind hears you, is that if I say I'm angry, then my mind is hearing that. Whereas if I say, gosh, I'm really feeling angry at Andrea for the way she was discouraging to me, then all that is acknowledging that one feeling I have towards Andrea at this moment. So there's difference in that, and the space that provides from who I am versus what I'm feeling at that moment is a really healthy way to connect and relate with our feelings. Okay, so we've talked about thinking, right? How do we think that can be healthy? How do we kind of tap into how we feel that can be healthy and can be beneficial? Another thing that is huge is self-care. And I know that word gets thrown around a lot. And I always like to say to people, what do you think of when you think of self-care? And oftentimes it's kind of like getting a pedicure. Well, I love a good pedicure, so no shame in that. But self-care is anything that is good for you, anything that is taking care of your body or your mind or your spirit. So instead of thinking how do I want to pamper myself, which is kind of what we take away from self-care, I would say this time in your life where you've finished treatment and you're moving on with life is a good time to say, okay, how do I want to take care of myself? From a physical, spiritual, emotional standpoint, what does that look like? Boundaries, that's self-care. One of my favorite quotes is saying no is self-care. too much social media. Maybe that's not self-care. Maybe a little bit of it is self-care if you enjoy it. You know, figuring out for you, because this is all individualized, but what for you does it mean to take care of yourself? And so I would encourage you to think through that and identify some things that you know are good for you from a physical, mental, spiritual standpoint, and really initiate kind of a care plan to do that. One of the things that I often talk with people about is kind of motivation, because that can be hard for any of us. And for things like self-care activities, sometimes it's hard to get motivated to do those. And so I encourage people to consider starting to do it versus waiting to want to start to do it. So I will start walking so that I feel better, instead of when I feel better, I'll start walking more, right? We know that walking, physical exercise, is good for our bodies, but the research is telling us how good it is for our head as well. Just to clear things out, to also remind us that we can impact our health. And that's one way of doing it, to do something that's good for us, all of those things. So sometimes, though, it is a matter of starting to do them in order to get that ball rolling versus waiting to feel like doing it. Because, you know, if I'm never going to wake up at 5 excited to work out, but if I start working out every morning at 5 or every few days at 5, then eventually I feel well enough that I'm motivated to do it. But it may take a bit. So sometimes pushing yourself to do it in order to start to feel better is kind of a good way of flipping it. So one avenue of self-care, and if you've heard me talk, you've probably heard me talk about mindfulness, but is practicing mindfulness. So what is mindfulness for those of you who may not be familiar? It is paying attention on purpose in the present moment, non-judgmentally. Okay, that's all it is. So when Andrea led us in that centering moment, it was a mindfulness moment. It was a, how do I pay attention to what's going on in my body? I'm doing it on purpose. I'm in this moment, and I'm not judging how tense or untense or whatever my body is. Research is telling us over and over and over how important mindfulness is for our emotional health. So if you're somebody who is spending a lot of time thinking back on your cancer journey, shoulda, coulda, wouldas, or a lot of the what ifs. What if this happens? What if that happens? What if? Then maybe mindfulness is something that would be really helpful to you, because mindfulness says, okay, if we spend more time in the present moment, we're going to be more focused, we are going to be less stressed, and we're going to have more compassion. So practicing mindfulness is one way that I think if you're looking at ways to improve your mental and emotional health, or to manage the stress of having had cancer and living with it as part of your life, mindfulness can be very, very helpful in doing that. Something else to consider, and some of this is mindfulness based, but one of my favorite definitions of suffering is wanting things to be different than they are. Think about that. Anytime we are really, really wanting it to be different, we are on some level suffering. Now, I am not saying that we get to a place where we want to have cancer, or we want to whatever. But there is a difference in holding on to that wanting it to be different and acceptance, right? Acceptance does not mean that you like it, but it does mean that you experience it for what it is. So a really simple example of this is I go to my favorite restaurant and I order fish tacos with mango salsa, and they bring it and it's not the mango salsa. And they come and tell me that they're out of the mango salsa, so they have this other salsa. Well, I can either be like, oh man, I love that mango salsa, but I'll get it next time. I'll be okay with this. Doesn't mean it's what I wanted, but I can accept it and move on. Or I can get really fired up about the fact that I came to this restaurant and I want my daggum mango salsa, right? But then who suffers from that? I suffer, because then I'm stirred up about it. So sometimes I will see patients who are months out of treatment and they are still saying, I just don't understand how I got it. I wish I'd never had it. You don't ever have to like that you've had cancer, but recognizing that you did, that it is what it is, and letting go of that wish that you had never had it is a way of accepting versus continuing the suffering, right? So experiencing things as they are. Okay, another just tip or suggestion or whatever you want to say that I have, that I am a big proponent of, is self-compassion. And I don't know if that's something, a term you're familiar with, but Dr. Kristen Neff is doing a lot of research on self-compassion. So I want to read a little bit of this to you because I think that she words it so well. I could try and say it, but I wouldn't do nearly as well as she does. So having compassion for oneself is really no different than having compassion for others. Think about what the experience of compassion feels like. First, to have compassion for others, you must notice that they are suffering. If you ignore that homeless person on the street, you can't feel compassion for how difficult it is his or her experience is. Second, compassion involves feeling moved by others' suffering so that your heart responds to their pain. The word compassion literally means to suffer with. When this occurs, you feel warmth, caring, and desire to help the suffering person in some way. Having compassion also means that you offer understanding and kindness to others when they fail or make mistakes rather than judging them harshly. Finally, when you feel compassion for another rather than mere pity, it means that you realize that suffering, failure, and imperfection is part of the shared human experience. They are but for fortune go I think that's not right. Anyway, self-compassion involves acting the same way towards yourself when you are having a difficult time, fail, or notice something you don't like about yourself. Instead of just ignoring your pain with a stiff upper lip mentality, you stop to tell yourself, this is really difficult right now. How can I comfort and care for myself in this moment? Instead of mercilessly judging and criticizing yourself for various inadequacies or shortcomings, self-compassion means you are kind and understanding when confronted with personal failings. After all, whoever said you were supposed to be perfect? You may try to change in ways that allow you to be more healthy and happy, but this is done because you care about yourself, not because you're worthless or unacceptable as you are. Perhaps most importantly, having compassion for yourself means that you honor and accept humanness. Things will not always go the way you want them to. You will encounter frustrations, losses will occur, you will make mistakes, bump up against your limitations, fall short of your ideals. This is the human condition, a reality shared by all of us. The more you open your heart to this reality instead of constantly fighting against it, the more you're able to feel compassion for yourself and all your fellow humans in the experience of life. I often will talk with patients who say things like, I should be handling this better. I should never have said XYZ. I shouldn't be so emotional about this. And I will say, wait a second, is that something you would say to somebody else? Let's flip the script. If I have cancer and I'm sitting here, would you say to me, you shouldn't feel that way? You shouldn't, blah, blah, blah. And they'll say, no, I would never say that to you, but you're saying it to yourself. So we're much more critical with ourselves than we are with others. Think about it as simply as if you walk by a mirror, right? And you might think to yourself, oh my gosh, my thighs look too big, or my arms look too big, or my hair looks ratty, or whatever. But would you ever say that to somebody else? No, we wouldn't. We are much more compassionate with other people. But when you think about it, it doesn't make any sense. Now, I'm not going to just tell people all kinds of willy-nilly things all the time and build them up with falsehoods. But I'm not going to do that with myself. But I do feel like being kind and compassionate with myself makes sense, right? So consider this, because I do think that we are typically more critical of ourselves than we are of others. And if you find yourself feeling down on yourself, ask yourself if what you're saying is something you would say to somebody else. And if it's not, then consider that. If this is something you feel like you're interested in, this www.selfcompassion.org is her website, and she's got a ton of great stuff on there. She even has a self-compassion assessment, so you can kind of see how hard you are on yourself. And so there's some neat work around that, around really being compassionate and building yourself up. I just like this quote that I would share. First, give yourself kindness and grace, then re-gift it as often as possible. But I like that it's first start with you, because I think that's a pretty important place to start. So we've talked a little bit about ways of being healthy moving forward, and ways of impacting our health. This is a 5-minute mental health checklist that I often give out to people and say, put this up somewhere. Ask yourself these questions. Are you eating regular meals? Are you showering? Are you getting enough sleep? Have you spent time outside? Are you connecting with someone you love? That can be a text. It can be anything simple. Have you exercised or stretched your body? That's going to be different. For some of you, it may be a 5-mile run. For others, it may be walking to the mailbox. But are you moving? Have you been thinking kind thoughts to yourself? That goes back to the self-compassion. And then, have I been comparing my life with others? These are things that can improve your mental health. And so having something where we just kind of evaluate the way that we're taking care of ourselves on a daily basis can really be beneficial. Okay, as a close, I wanted to read this to you. I don't know how many of you are familiar with this book. It's titled Between Two Kingdoms, by Suleika Jawad, but she had leukemia, and the two kingdoms she's referring to kind of the well and the sick. And so she's written this, and I want to read it aloud to you because I think it really speaks to kind of where you are, and hopefully as words of encouragement as you go along your way. Everyone who is born holds dual citizenship in the kingdom of the well and the kingdom of the sick, Susan Sontag wrote in Illness as a Metaphor. Although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. As I grew sicker, I watched my old self vanish. In place of my name, I had been issued a patient ID number. I learned to speak fluent medical ease. With my bald head, pallor, and port, illness became the first thing people noticed about me. As months bled into years, I'd adapted to the mores of this new land as best I could. It was the outside world, the kingdom of the well, that had grown alien and frightening. It is where I find myself now, on the threshold between an old familiar state and the unknown future. Cancer no longer lives in my blood, but it lives on in other ways, dominating my identity, my relationships, my work, and my thoughts. I am done with chemo, but I still have my port, which my doctors are waiting to remove until I am further out of the woods. I am left with the question of how to repatriate myself to the kingdom of the well, and whether I ever fully will. How to repatriate myself to the kingdom of the well, and whether I ever fully could. No treatment protocols or discharge instructions can guide this part of my journey. The way forward is going to have to be my own. And so if I just encourage you that what your way forward is your own. You know, what things stand out to you as far as your physical health and your cancer journey, and what that means moving forward, how you want to figure out how to spiritually and mentally and emotionally care for yourself moving forward. All of these are yours to figure out. And I'm glad that you're all here and at a place to do that. think Andrea is going to close us out with one more thing before we finish up and can have some time for questions.
Thank you, Sarah. So the picture on the right, well, it's my right, it might be your left. You know what I mean? Is a picture of a redwood sprouting new growth from its trunk. And redwoods are one of the few trees that can, like if you cut them or make a wound in them, they'll sprout new growth. And I thought that was really cool and relating to survivorship, because just when you think something's never going to heal, then comes this new offshoot of things you never expected, good things. And so I wanted to read this poem to you by Ada Limon, Instruction on Not Giving Up. More than the fuchsia funnels breaking out of the crabapple tree, more than the neighbor's almost obscene display of cherry limbs, shoving their cotton candy colored blossoms to the slate sky of spring rains. It's the greening of the trees that really gets to me. When all the shock of white and taffy, the world's baubles and trinkets leave the pavement strewn with the confetti of aftermath, the leaves come. Patient, plodding, a green skin growing over whatever winter did to us. A return to the strange idea of continuous living despite the mess of us, the hurt, the empty. Fine then, I'll take it, the tree seems to say. A new slick leaf unfurling like a fist to an open palm. I'll take it all. So after the winter, what it does to us, our stubborn hope and our hands unfurling to accept whatever's coming. Thank you.
Thank you so much. So if there are any questions, if you can type your questions in the Q&A section at the bottom. Okay. And while we're waiting, I was thinking about something as a patient advocate. Years ago, I did a support group called Being Your Own Patient Advocate. And in that group, I'll say I'm educated, I've have case management experience, but in working in oncology, I've learned the largest percentage of what I've learned directly from working with the patients. And in doing that particular support group, a lot of people would tell me, well, say they've been in treatment for a year, they've been going to treatment twice a week, twice a month, ongoing for a year. And in that experience, although it was a whirlwind initially, they fell into a routine where from the time they get out of the door, they joke with the valet, they know the schedulers, the nursing staff, they built a bond, their families and children and caregivers, you're sharing pictures and holidays together. And all of a sudden, treatment is done. And they go home and it's kind of, what do I do? I don't have another routine. I'm not working anymore. Just a different life. And so I was so glad to hear that list that you showed, Dr. An, of all the supports within Novant Health Cancer Institute, as well as what cancer services offer. And I was just wondering, and I don't know who should answer this, but where do you feel a patient who, let's say, has been out of treatment for 2 months, they're not coming back for another 6 months for maybe a follow-up, or 3 months for a follow-up, and they just don't know what else to do? Who should they call to get started with talking about, some speaking with a dietitian or integrative medicine supports?
I think that's a wonderful question. It's sometimes you're seeing us every week, every other week, and then all of a sudden you sort of feel that, you're almost as if you're a student, you're studying for this exam for a year, and then you're done with the exam. You're not sure what to do the next day, right? So kind of feeling that that's normal, and we do have a lot of resources for those, and that can be anyone between, our oncology nurses. It can be, I think, one of the best ways that our patients reach out is to the nurse navigators. Of course, you can reach out to our cancer services. You can reach out to any of other services, our dietitian, if you have any concerns for one area. But at the same time, I think sort of overarching, I think starting with our nurse navigators, because they work closely with cancer services. They work closely with Sara and, Andrea and all the other providers that they can guide you to certain areas. If the nurse navigators feel like, oh yeah, let's meet with our integrative, clinic and see, is there a massage that might be beneficial for you? Even if you're done with chemo treatment, or okay, let's just keep, touch base in a couple weeks or 1 month, or should you meet Sara and just, if you're anxious about your condition, let's meet with Sara and go from there. So I think it's great. It doesn't mean that you are losing that connection with any of the providers or any of our dietitian or anyone, but it means that we're giving you more time to recuperate, to meet, to be with your family and friends, maybe go back to work, maybe, do some of the things that you love to do, go, play softball, or, so it's just a time to enjoy, at the same time, keeping that connection, so that if you need help, or if anything joyful is going on, you can let us know, certainly. And we're always happy to see you. We have patients coming in saying hi, and we're always happy to see our patients doing so well.
Sorry, we have a question. How can I get a copy of The Unexpected Gift?
They can, I can leave one with a person's name on it at the front desk, and they can swing by the cancer center to get it. Or we could even, if there's a few people who reach out to you all, maybe if you're interested, let Felicia know. And then Felicia, you can get us a list, and that way we can get you, if there's 10 people that want books, we can get you some books or whatever. Would that be okay?
Yes, that's perfect. And
so just let Felicia know, and then we'll make sure you get one.
And I'll just leave that. We are at Cancer Services. Our phone number is 336-760-9983, or you can go to cancerservicesonline.org and shoot us a message. Please don't be shy about the questions.
So this isn't related to a question per se, but one of the things I think is really great is our support groups. And it's people at any stage of their illness, whether they're getting first diagnosed, whether they're out so many years of treatment. There's just a broad spectrum of people. And so to me, like, that's a really great way to feel connected to a group of people who get a sense of what it was you went through or what you're going through, instead of just feeling like you're thrust out into the world, feeling like you have nothing under your feet. You can connect back to people who kind of get it. So to me, like, the support systems are a really great way to stay connected. And also we have volunteers who come back that want to stay connected to the cancer center. So if you're interested in volunteering, that's something you could check out too.
That makes me think too, Andrea, is that Felicia, I hear some of that same from people. And one part of it too, I think, is that the hope here, and I'm sure at Wake Forest as well, is that when patients come, they feel a sense of being received and supported and cared for. And people will say, I know that when I walk in this building, either the person sitting beside me either understands, or they have cancer themselves, or it's a spouse of someone with cancer. So they're out in the world, right, living, but then when they come in here, it's like everybody gets it, kind of different. And so that is something that people often crave. The other reality is that, and I'm sure many of you have experienced this, is that relationships change, right? People often say they're surprised by who maybe wasn't as supportive because they seem to feel uncomfortable with it. And then they're surprised by people that were really supportive, that maybe they didn't know quite as well. And so relationships tend to shift. Then they develop a community here. I would say too, though, that that moving forward can be something that's helpful. I have some patients who have left, who are not really getting active treatment, and they've connected with people out in the community too. Like a girl I saw recently, she said, I didn't know my boss had cancer until recently. And now we've gotten really close. And another patient of mine said her neighbor, once she was diagnosed, they really became each other's support system. And so I think that can continue outside of this community, whether it's through cancer services or just through life. As you meet people, that's a commonality that you may have. And so we want to stay connected, and we also want you to continue to grow and thrive, and know that relationships evolve. Oops, you're on mute, Felicia.
Sorry about that.
I just saw your lips moving.
So we don't have any more questions. I just want to say thank you so much for joining us for this presentation. It's been very informative, as someone stated in the chat. Oh, wait. Yes, it is recorded. This is recorded, and we will send a link out so that if you'd like to review the information, the link will be in your email. Again, I just want to say thank you so much. Remember that survivorship starts, as Dr. An said, at the time of diagnosis. We're going to begin to practice mindfulness, being active, learning not to say, I will, when I feel better. We're going to do it to feel better. And if there's anything that cancer services can ever do, please just call us. As it was stated, survivorship starts as soon as that diagnosis is provided, and we are there with you for life. So our supplies and equipment, lymphedema supplies, bras, prosthetics, all of that, you can be 10, 15, 20 years out. You can call us for direct assistance or resources within your area. We want you to know that it is possible to have a very satisfying life after diagnosis and treatment. And so we're here right along with you.
And I just want to say thank you, Felicia. I know that we at Novant really appreciate all that cancer services does, and could not be on this. Well, we could be on the journey without you, but we don't want to. And we really, really appreciate all you do. And we know our patients greatly benefit from it. And we're thankful you're in our community.
Thank you so much. Thank you. Hope you all have a great evening.
Thanks.
Thank you. Bye-bye.